Okay, so in this lecture, we're going to discuss pregnancy diagnosis and resynchronization of dairy cows. Of course, some of the discussions we'll have about pregnancy diagnosis are also valid for beef cattle. So what's important to keep in mind is that reproduction is really fundamental for reproductive, it's really important for profitability of dairy herds. In dairy herds, it maximizes milk production by keeping the cow in the highest phase of the lactation for a longer number of days in the calving interval. We discussed that Tuesday. It's basically about of the days between two calvings, what percentage of those days the cow was in the highest efficiency phase. It reduces involuntary culling because of poor reproduction. Reproductive failure is really important. It's only second to mastitis as far as involuntary culling, which means culling that are not by design, such as genetic improvement and so forth. The poor reproductive efficiency in lactating cows requires that you maintain more heifers because of course, if you have more culling of cows because they didn't get pregnant, then you need to replace them with a new animal. And raising heifers is really expensive. It's actually, there are estimates that show that raising heifers, replacement heifers can cost as much as a quarter of all the costs of the dairy. So for every $100 is spent, you can have as much as $25 going to heifer raising. There are old studies, but important studies that show that the average value of a new pregnancy is about 278 days. It depends a lot on the lactation number of the cow. It depends a lot on what phase of the lactation the cow is, but that's a good average that you can use. And the loss of a pregnancy is really expensive. Can go from $555 to $640. And the reason there is that usually pregnancy losses happen later in lactation, and cows that have pregnancy losses tend to have a harder time getting pregnant. So those cows are at very high risk for being culled. This is just to show you a projection of pregnancy rates going from 8% pregnancy rate all the way to 30% pregnancy rate. What is the projected milk yield per cow in the herd? So you can see that from 8%, the milk yield is approximately 57 pounds. And when you get to about 20%, the milk yield would be somewhere around 74 pounds. And when you get to 30% in the same herd, you would expect to be close to 77 pounds in average. This is looking at a herd of a relatively low production. It's only 18,000 pounds per cow per year. So because the better fertility or greater pregnancy rate increases the average milk production per cow per year, you can obviously see an increasing return from 8%. This would be the base comparison, 8%. And you can see that you go to 10%, you increase in $200 per cow per year. You go to 16%, you go to $500 more per cow per year. And then you go to 24%, you get to $700 more per cow per year, and so on. So because you increase efficiency of milk yield, you increase milk yield as a whole, you also improve the return. What's interesting to look at is that the most dramatic gain in return happened before 26% pregnancy, 28% pregnancy. So if you look at the curve here, there's a steep gain from 8 to 24, 25%. But then after that, it somewhat plateaus out. So we tend to say that a herd that is at pregnancy rate of 29, 30% is a herd that doesn't need to worry about reproduction anymore. All right, this is something we discussed on Tuesday, so I'm going to go over it briefly. Think about, let's think about how pregnancy rate affects milk yield. Here we go then. So you have milk yield, the red line, feed cost, you have the green line. Let's imagine that the difference between what the cow produces in milk and how much she eats, dry matter intake, is your profit, okay? So let's say that the cow in the beginning of the lactation, for every 1.7 pounds of milk she produces, she's only eating 1 pound of dry matter. Let's say that later in lactation, mid to late lactation, the cow is producing 1.3 pounds of milk for every 1 pound of dry matter that she eats. So it's obvious that earlier in lactation, you have greater income over feed cost. Like I mentioned before, let's imagine that 90 days, the first 90 days in lactation is the most profitable. So let's think about what happens to the percentage of days between two calvings that the cow spends in the most profitable phase of the lactation. So if you have a herd with 21-day pregnancy rates of 18%, the calving interval of the average cow is 14.1 months. So if the cow spends 90 days in milk of those 4 months, which are 428 days of calving interval, she spends 21% of that interval at high production. But if you have a pregnancy rate of 30%, the average calving interval is 12.7 months. And therefore, now the cow spends 90 days out of the 385 between two calvings in high production, or 23% of that interval. So it's obvious that this first, the 30% scenario, the cows are more profitable because they spend more time in this high production phase of the lactation. So why do we examine cows? We examine cows to diagnose diseases, evaluation of health status. This is not as common as used to be back in the beginning of the 2000s, 1900s, let's say it that way. Diagnose non-pregnant animals, that's critical. This is really the reason why we examine cows. We also try to diagnose pregnancy losses earlier than later, so that you can do something about those cows that are losing pregnancy. And we allow then, once the non-pregnancy and the pregnancy loss are diagnosed, that allows us for prompt response to the situation, meaning either treatment of a cow that is losing pregnancy or resynchronization of a cow that is non-pregnant. So in dairy herds, the major problem we have is that way less than 60% of cows, lactating cows, become pregnant to first AI or first service. And usually AI submission rates are very low. It's less than 60%. So basically, after the first service, you still have anywhere from 40 to 60% of the cows non-pregnant. And even though quite a few of those cows are going to show heat 21 days after that first service, because we are only able to catch maybe 60 to 70% of cows in heat, we miss quite a few of those cows. So those cows linger in the herd. And so it's better to do an early non-pregnancy diagnosis so that you can do something about these cows. In beef herds, what is really interesting is that when you have pregnancies early in the breeding season, you tend to have heavier calves at calving. You tend to have calves that gain more body weight. And so those are very important things for these animals, or for beef herds. So there's a need for timely diagnosis of non-pregnant cows and resynchronization of cows to assure that they are re-inseminated rapidly so that we reduce the interval from calving to conception. But it's critical when you're doing this not to make the mistake of saying that a cow is non-pregnant when she's actually pregnant. The worst mistake you can make in these situations of pregnancy diagnosis is to say that a cow is non-pregnant and she's actually pregnant, because the idea of preg checks or pregnancy diagnosis is to find the non-pregnant cow and do something about them. And doing something about them usually involves giving injections of hormones like prostaglandin, which, if the cow is pregnant, will abort her. So you cannot make that mistake. So manual palpation of uterine contents. That's one option that is still used. It's becoming more or less less popular because of ultrasounds becoming more accessible. So you can palpate the amniotic vesicle, which is this portion right here that you can see. You see the calf inside of the uterus. You see the allantoic sac, and then you have the amniotic vesicle. The amniotic vesicle you can palpate starting at 28 days in heifers and 32 days in cows. And because by 60 to 60 days of gestation, it becomes less tense, it becomes a little more flaccid, it's not palpable anymore after about 60 to 60 days of gestation. You can do membrane slip, which basically is to pinch lightly the uterus and the content inside, and then you can feel actually the placenta is slipped through your fingers. So that's what we call the membrane slip. And that can be done as early as 30 to 35 days of gestation in the ipsilateral horn to the pregnancy, and 70 days in gestation in the contralateral horn. Remember that the fetus of the cow is different, or the embryo of the cow, fetus of the cow is different than the mare's. It doesn't travel throughout the uterus. It actually expands the placenta so that the pregnancy that was established in one horn, the placenta migrates and goes all the way into the opposite horn. Care not to cause hemorrhage and abortion if you do it with too much pressure. So what about placentomes? So placentomes would be the junction of the coroncle and the cotyledon, and you can palpate them as early as 70 to 80 days in gestation. And the fremitus in the middle uterine artery, the middle uterine artery will be this artery coming down here from the smaller curvature of the uterus back to the aorta, I think it is, but we'll check. And you can start feeling the fremitus at 90 days of gestation in the side where the pregnancy is, and at 6 months of gestation in the opposite side. Fremitus is basically as there is pulsation in the artery, because of the intensity of the pulsation is so high, you can actually feel some trembling, let's say, of the artery arterial walls. Okay, what about biochemical pregnancy diagnosis? Now it's becoming more and more popular, and there are actually some co-ops that are even suggesting that we shouldn't do any more rectal palpation because of welfare issues. So the idea here of the biochemical pregnancy diagnosis tests, there are two ideas. One is to detect something that the embryo produces and it goes into the circulation of the cow. And the other one is to monitor the progesterone of the cow. So let's think about it this way. The cow comes in heat. There is an ovulation here. This little burst is ovulation. And let's imagine that the cow was actually inseminated and she got pregnant, okay? So after ovulation, there is a slow rise in progesterone concentration, which is this blue line right here. And because now there is an embryo, by 12 days or so after fertilization, it starts producing interferon tau. It blocks the production of prostaglandin at the end of the estrous cycle, which would normally occur around day 16 to 18. And because there is no prostaglandin, that CL remains in the ovary, which maintains the pregnancy. So one of the strategies would be to evaluate something that the embryo produces that signals, or that is a consequence of the signaling of the interferon tau, or to measure progesterone sequentially to determine whether or not that cow regresses CL. So just to be clear, you can see then that normally around day 17, the cow would produce prostaglandin in her own uterus that would break down the CL and would start a new estrous cycle. But obviously, if you have an embryo and the embryo is well developed, it produces this protein, interferon tau, which blocks the production of prostaglandin and therefore does not allow for the luteolysis. So one of the things that the embryo produces actually in the trophoblastic cells that are produced is a protein called pregnancy-associated glycoprotein. And this protein is also known as pregnancy-specific protein. And here you can see in this graph, pregnancy-associated glycoprotein measured by radioimmunoassay. And here you have the days after AI. So you can see that the rise in this, what we call PEGs, it starts really only about day 20 or so. And then you can continue to see it at day 30, 40, 50, and so on. It's interesting in this data here that higher progesterone cows have embryos that produce more of the PEGs, just an indication that perhaps having higher progesterone during the development of the embryo is a good thing so that they develop further, develop faster, and produce more of this protein. Like I said, the initial increase in concentration of these PEGs happens somewhere around 20 days, so 15 to 22 days of gestation. But in almost 100% of cows that are pregnant, they're going to have some increase by day 24, and that will continue to increase throughout the gestation as the embryo gets bigger. So the recommendation from the different groups or different labs that produce this test is to start diagnosing pregnancy with the test at 28 days after service or AI. The test can be done in plasma or serum, and then there are new tests now that are being used in milk, but they're not perhaps as well studied, let's say. But you should not use the test in cows that are less than 60 days after calving, because the protein, the pregnancy-associated glycoprotein, has a very long half-life, and particularly cows that have had some sort of retained placenta and things like that, they could still have false positives at 60 days, up to 60 days after calving, because that protein is still there, even though they may not have been inseminated or anything. There are some new on-farm kits that provide results within 21 minutes, okay? The other ones, the blood tests that had to be shipped, they would actually have a turnaround from sampling to results of about 72 hours. Now there are some tests that can be done on the farm that gives you 21 minutes turnaround for diagnosis. Now the question is, you as a consultant, as a veterinarian, how do you determine whether the test is good enough to be used in your client's herd? So you should always think about diagnostic tests. Think about it in a 2x2 table, right? Where you have the true positives and true negatives, and then you have the ones that tested positive and the ones that tested negative. So then you calculate the sensitivity, which is A divided by A plus C, which means the ones that tested positive and were actually positive divided by all the actual positive cows. In this case, we're talking about pregnant cows. Specificity, it's D, which means non-pregnant cows that are diagnosed correctly, non-pregnant, divided by all non-pregnant cows. Positive predictive value are the cows that were pregnant, that tested pregnant, divided by all the cows that tested positive. And negative predictive value or predictive value negative are all the cows that are the cows that were non-pregnant, that tested non-pregnant, divided by all the cows that tested non-pregnant. So in a way, sensitivity determines the accuracy in diagnosing positive cows. Specificity determines the accuracy in diagnosing negative cows or non-pregnant cows. Negative predictive value determines the accuracy of a negative test, and positive predictive value determines the accuracy of a positive test. So what are the known studies that have looked at these new tests, particularly the rapid visual one, which will be done on farm? So the rapid visual one is the one that is done on farm. This plasma optical density and and milk optical density are the ones that are doing in the lab. And so you can see that the sensitivity ranges from anywhere around 92% to 96% to 98%, which means that out of 100 pregnant cows, you find the 90 96 to 98 cows out of those 100 cows that are pregnant. Specificity, here you have anywhere from 94 down to 85%. So out of the open cows, you only find 94 to 85% of them with the test. And then when you look at the positive predictive value, when you call the cow pregnant, you are correct in 95 to 87% of the times. When you call the cow open or non-pregnant, you are correct anywhere from 96 to 98% of the time. So the question you have to ask yourself are, is it acceptable to misclassify 2 to 4% of pregnant cows? To say that, to not pick up 2 to 4% of the pregnant cows? Is it acceptable to not pick up 6 to 15% of non-pregnant cows? That's something we're going to discuss in class. The other question is it acceptable to classify 5 to 13% of non-pregnant cows as pregnant? Okay, when you think about the positive predictive value here, you have anywhere from 5% to 13% of cows that are called pregnant when they're actually known to be open or non-pregnant. That is really something we need to keep in mind. This is another study that was done, and here they used beef cattle. And in this study, it's really nice because when they collected the sample, they were also doing the ultrasounding. So here there is no lag between when the sample was collected and when the pregnancy diagnosis was done. And again, you have very similar results. Sensitivity of about 96 to 97%. Specificity lower, around 87 to 90%. Predictive value positive, anywhere from 93 to 94. Predictive value negative, anywhere from 96 to 93. And the accuracy somewhere around north of 90%. The same issues occur here, though. We are missing out on finding 3 to 4% of pregnant cows. We're missing out on finding 10 to 12% of non-pregnant cows. And if we're doing this test to find the non-pregnant cows and do something about them, I wonder if this is really worth it. And then the other question here in this study is it acceptable to classify 5 to 7% of pregnant cows as non-pregnant? It's exactly what I told you earlier, as far as not making the mistake of calling a cow as non-pregnant when they're actually pregnant, because you're going to abort these cows. So even though these tests are really useful, particularly in regions where veterinarians are not available and so on, for most dairy operations, this can create a significant economic loss if you start aborting cows that should not, that are actually pregnant. So what about the use of progesterone for diagnosis of pregnancy? Well, like I mentioned before, the expectation is that if a cow comes in heat, she ovulates, and she gets an embryo, she has an embryo in the uterus, by around day 10, 12 or so, she will start producing interferon tau, which blocks the production of prostaglandin. And so instead of having a drop in progesterone around day 18 after the previous estrus, the progesterone stays high. So the theory of testing for progesterone is that when they come in heat, they have low progesterone. And if at 21 days after estrus, they still have high progesterone and they were inseminated, then there's a chance that they're pregnant. So here's, for example, an illustration of what the progesterone concentration would be for a couple of cows, okay? The solid line would be a cow that got pregnant, and the dotted line, a cow that didn't get pregnant. These are sequential samplings in the milk, and you can see that the progesterone does exactly what you would expect. Minus 21 would be the previous estrus from the estrus that she was inseminated. So you see that progesterone is low, it rises, and then it goes down. Then you see that at estrus, the progesterone is low again and starts rising again, and so on. But the cow that got pregnant, at 14 days, it continues to go up and plateaus after 21 days from a previous estrus. Whereas the cow that didn't get pregnant, there is a peak around day 14, 15, and then it starts to decrease because luteolysis happens. So if you're sampling these cows multiple times And you see this pattern of progesterone that was low and continues high for more than 21 days after a previous estrus, then you could assume that the cow is actually pregnant. So we did one very small study in heifers, actually, and we had several blood samples of the animals. And so we had progesterone of the animals at 30 days after AI, and let me rephrase this. We had a study in which we had progesterone at 21 days after AI, and at 30 days after AI, we had diagnosed pregnancy. We found that 1% of heifers that were pregnant at 30 days after AI had progesterone below 1 nanogram per ml at 21 days after AI. So when we calculate the sensitivity and the negative predictive value, we see that it's 90%, 99%, and 98%. So it's not perfect. But what's worse is that 15.2% of heifers that had never been bred had progesterone greater than 1 nanogram per ml 21 days after AI, which would result in a specificity of 85%. So even though you basically, with the progesterone at day 21, have very good sensitivity, which means of the animals that are pregnant at 30 days after AI, you'll be correctly in classifying 99% of them at 21 days after AI with progesterone. When you use progesterone at 21 days after AI to diagnose the non-pregnant animals, it's really not that accurate because you end up calling 15% of the heifers that were never bred as heifers that could potentially be pregnant. What are the causes of poor specificity for progesterone in this case? Would be variations in the estrous cycle length, early embryonic death, inaccurate estrus detection, pyometra, and so on. So it may not be necessarily optimal. Dr. Bizzinotto actually has some data that he will probably share with you at some point during his lectures with you. Milk progesterone, this is actually the data that Dr. Bizzinotto has, is on milk progesterone. The concentrations in milk can be higher than, in whole milk can be higher than skim milk, so you have to think about that. Progesterone cutoff ranges between 1 and 3 nanogram per ml in whole milk. So usually you have a little higher cutoff of progesterone in milk than in blood. But you gotta be careful with the way you store and transport the samples, okay? There can be some very big changes in the reading depending on the conditions of transportation and storage. In whey samples, the progesterone can stay pretty stable for up to 1 week during storage. Dr. Bizzinotto has data and he'll talk to you about this. Now let's look at ultrasonography, okay? So there are portable ultrasounds and there are ultrasounds that are less portable. In this case here, you have a cart and you have basically a battery, a bulb battery that we use to power one ultrasound here. And you can see that we are out on the field working with several heifers. So the equipment can be a little expensive, but it's becoming more reasonable. It requires experience to avoid calling a non-pregnant cow or a pregnant cow as non-pregnant. Again, remember, the main thing is never call a cow that is pregnant as non-pregnant. If you're really good and if you have learned how to palpate and retract the uterus, you can take usually less than 30 seconds from the time you touch the cow to the time that you've done the diagnosis. It depends really a lot on how well trained you are and how many cows you've done. The one advantage of having ultrasound is that particularly in smaller herds where they can actually manage cows individually, you can actually diagnose what they have in the ovaries, like follicles or CLs, and determine what the best resynchronization for that cow would be. Okay, so here on this picture above here, you have actually a cow that is open. You can see that the uterus is curled, and you see the uterus right here. The delineation of the uterus is here, all the way to here. Here you have a cow with a follicle in one of the ovaries. So this is the ovary right here. And then you have a cow with a big CL in one of the ovaries. The ovary is actually all of this here. And again, cavitary CL here, you can see in the ovary that is delineated by this line here. So that's definitely one of the advantages of using ultrasounding. Of course, it's much easier to detect early pregnancies with ultrasound than by hand. People that have been doing this for a long time can palpate a vesicle as early as 32 days, but it takes much more time than doing the ultrasound. Here you have a pregnancy that is 45 days. So we're going from the embryo stage to the fetal stage and all the way to a 50-day pregnancy, okay? And of course, another advantage of ultrasounding is that it's easier to find twins, for example. So in herds that manage for twins, that is something that can be used, that can be useful. And one thing that is really useful, particularly for people that are doing embryo transfer and selling pregnancies, is the sexing of the embryo or the fetus. So when you look for sexing, basically, if you have a male calf, you focus your attention in the umbilical cord, and if the tubercles are, the genital tubercles are immediately caudal to the umbilicus, as you can see here in this ventral view or this lateral view, it is a male because that tubercle is going to form the prepuce. And if you see the tubercles, which are these little structures right here, right at the base of the tail, then it's a female because that's going to become the vulva of that female. So here you have a 60-day female calf, and the reason why it's a female is because you can see the umbilicus, you can see the two femur right there, and then you see here the tubercles right at the base of the tail. I'm sorry, it's right here. Those are the vertebrae of the tail, and these are the tubercle right there. And this is a male calf because you have the femurs right here, the umbilical cord here, and then you have right here the tubercles, okay? So you can see that this is the attachment of the umbilicus, and that's those are your tubercles. The other advantage of using ultrasound is that you can more easily identify pregnancies that are not normal. You can see that this pregnancy here is not normal because even though there is a collection of fluid, the fluid is a little murky, has these white dots everywhere indicating that there's probably debris inside, and that's just not normal for a pregnancy. Here you have a 40-day pregnancy, large uterus, but you can see the membranes are very evident. So it's almost like there's detachment of the membranes, or the membranes are falling into the uterus. And here you have, again, another pregnancy, 40 days of loss. And here you have a loss of an embryo because even though the fluid is very normal, I probably didn't find an embryo, or there was an embryo without a heartbeat. But what's interesting in this picture is that the thickness of the uterine wall is pretty much greater than a pregnant cow, okay? So when the uterine walls are very thickened, it usually indicates some process of inflammation that can be associated with pregnancy loss. All right, so just to make sure you understand one thing, dairy cattle in particular are very prone to embryo losses, okay? At 2 days after AI, you can get as much as 76% of zygote. At 6 days after AI, you can have about 50 to 60% viable embryos. But by 28 days and 42 days after AI, you're down to about 40 to 35% of pregnancies. And at term, you can be as low as 28%. So pregnancy losses from fertilization to term can be as much as 60%. So that's why we have to do pregnancy reconfirmation, okay? We have to find the cow pregnant at 28 days, and then we have to reevaluate the cow. The earlier you do your pregnancy diagnosis, the greater risk of pregnancy loss you have because you have more days of pregnancy for the pregnancy to be lost. So the common practices in dairies are to check for the first time with ultrasound at 28 to 34 days, or by hand at 35 to 42 days after AI, and then reconfirm anywhere from 5 to 7 weeks later, and then do a final confirmation before drying off at 6 to 7 months of gestation. And this last one here is critical because If you dry off a cow and you put intramammary tubes in her that have a withhold time of 40 days to 45 days, and she's open, now you're feeding a cow for 45 days, that will not start a new lactation. So that's really critical. All right, to finish this lecture, what about resynchronization of non-pregnant dairy cows? I believe that Dr. Galvão is going to talk to you about timed AI protocols, but the same for first service and resynchronization. The timed AI protocols go bad when you cannot control the growth of a new follicular wave. You don't recruit a new follicular wave in the cows. The follicles grow under low progesterone. There is no control of luteal regression at the end of the protocol, so cows can come in heat at any time they want. And there is no control of ovulation. So for you to be successful, the majority of the cows need to have a new follicular wave recruited. That follicle needs to grow under high progesterone. There needs to be luteal regression at the end of the protocol, and ovulation needs to be synchronized and under low progesterone so that the cow can get pregnant. So I believe that Dr. Galvão is going to talk to you about this, but I just want to make sure that you understand how we establish or we achieve successful timed AI protocols. Well, you have the follicular waves, right? So here you would have, let's say, either the cow is coming in heat or you gave a generate injection. Right after that, usually anywhere from 36 to 48 hours later, starts a new follicular wave. And then there is a follicle that becomes dominant and establishes dominance, but around 9 to 10 days after estrus, that follicle will start regress because there's too much progesterone coming from the CL. And since it's been only 10 days that she came in heat, she will not have luteolysis. Then once these follicles start dying, there's then lack of estradiol and inhibin coming from the dominant follicle. So a new follicular wave can start. And if this cow is a normal cow that was not inseminated, like I said before, around 17 days after estrus, she has luteolysis because prostaglandin is secreted. And now these dominant follicles from the second follicular wave can have a rise in estradiol and then peak of LH and ovulation. Well, when you're using a timed AI protocol, particularly those based on GnRH, if you start too early from 0, which would be day of estrus, to 4 days after estrus, when you give that GnRH injection, the follicles are too small and they don't respond to the GnRH injection. If you give the shot of GnRH at 5 to 9 days after estrus, then the follicles are big enough to ovulate, create a new CL, and start a new follicular wave right here. So you have synchronized start of a new follicular wave in 96% of the cows. Because it's in the middle or at the beginning of the estrus cycle, also these new follicles will grow under very high progesterone. If you start between days 10 and 15, only 54% of the cows start a new follicular wave because the follicles from the first follicular wave will be regressing and the new follicles are too small. So you don't get a very good response. So you don't have synchrony of a new follicular wave. And even though if you start later on from 16 to 20 days after estrus, the protocol, if you give the GnRH 16 to 20 days after estrus, you get 77% of cows starting a new follicular wave, which is not bad because we have here large follicles. The problem is, like I said before, luteolysis is already happening somewhere around day 17. So if your protocol requires a GnRH and 7 days later prostaglandin to cause luteolysis, well, if I gave GnRH at day 17, on day 24 or 7 days later, luteolysis would already have happened. So I'm not synchronizing luteolysis and I'm not synchronizing ovulation. So here are some protocols that are commonly used for resynchronization. Let's imagine that the cow is timed AI for the first time in the lactation on a Thursday. It's 73 days in milk. 4 weeks later, you can give GnRH to this cow. It would be on day 32 post-AI, for example. And then 1 week later, you could palpate by hand, and if she's open, then you can give her prostaglandin. That's one option. The other option, would be to do the preg check 5 weeks after the timed AI. And if they're open, then you can start the timed AI protocol there and follow through. These are just a few examples. We can actually discuss this more at length in class. Here's something that people used to think was true, but it came down to not be really how most cows behave. We always thought that the majority of cows that were inseminated on day 0 would come back in heat at day 20 to 21, 22, 23, 24 after a previous heat. So if that was true, so this day 20 now after a previous AI would be the new day 0 of this new estrous cycle, right? So you have here, day 20 will be new day 0 for one cow, day 21 will be the new day 0 for the other cow, and so on. So the thought was, if we were to start the cows between 5 and 9 days of the new estrous cycle, to make sure that the majority of cows that came back in heat from 20 to 24 days from a previous AI start between 5 and 9 days of the new estrous cycle, we would give the GnRH of the resynchronization at 29 days from the previous AI. So it's basically looking at when I do the subtraction of when I gave the GnRH to when she came in heat, it's days 9, 8, 7, 6, 5. So if all the cows come back in heat 20 to 24 days from a previous AI, then theoretically starting the resynchronization at 29 would be ideal. The problem is this. Only about 85% of the cows have true synchronized estrus after timed AI. And even if you're not using timed AI, if you're breeding off of heat, 90% of the cows that are bred off of heat actually are not in heat. So there's at least 10 to 15% of cows that you thought were in heat or were ovulating when they were not. The other issue is that about 15% of the cows have short luteal phases, particularly after the first AI. So you add another 15% of error there. And we discussed this earlier, right? We have very high pregnancy losses from early on in gestation to about 70 days of gestation. So if you have 58% of cows with a viable embryo on day 6, but only 40% are pregnant at 28 days after AI, which is 22 days later, that means that you're having about 31% of cows with pregnancy loss from 6 to 20 days of gestation, which would mean that in all the animals inseminated, you would have about 18% of cows with abnormal return to estrus. So it's not surprising that only 50% of the cows actually come back to heat 20 to 24 days after a previous AI, because of all these changes or all these nuances to both synchrony of the estrous cycle, detection of heat, short luteal phases, and embryo losses. So this is actually data from several dairies across the US. And what you see here is that in all the way from 500 cow dairy to 8,000 cow dairy with different production levels, only about 51.7% of the cows truly come back in heat 20 to 24 days after a previous AI. So we need to pre-synchronize the resynchronization, which are the experiments that we did. And we'll talk about it in class, that the main protocols for pre-synchronizing a resynchronization would be to use prostaglandin when they're found open, and then 10 to 12 days later, you start the timed AI. Or you can give GnRH 7 days before you diagnose them open, or at open diagnosis and start the timed AI 7 days later. Or you can do a protocol that is based on a CEDAR insert as soon as you find them open and start a protocol. Those things we'll talk about in class, which is easier to discuss